It's CommonWell TV 2022, right here from our Orlando studios, as we introduce you to some of our Commonwealth Health Alliance members, but also introducing you to some of our very own here from Commonwealth. It's time now to hear from the Executive Director, and that's Paul Wilder. And Paul, let's start with this. Commonwealth's been using FHIR since its inception, but soon Commonwealth will be enabling discrete data exchange across the network. What does that mean for patients and for providers alike?
Yeah, Commonwealth's been using FHIR for many years, primarily for patient management, identity management, and for document exchange. But really, we want to move to discrete data. And to give you an idea what discrete data, we're talking about things like that one lab result, that atomic thing from 12:22 p.m. from yesterday, versus sharing an entire document to find that one little piece of data. It's like, as I love examples, right? So it's like taking your tax return, which is hundreds of pages, and all you're trying to do is find your gross income, which is one line on the first page. It says one number. And we want to be able to get to that finite thing as quickly as possible, which breeds a lot more innovation of other apps that can work at speed, collecting data, using the data to provide better healthcare for all of us.
Paul, as you know, data quality is so critical to Commonwealth. So why is it just so critical? And then not just how we can improve data exchange, but also to improve equity in healthcare.
Yeah, the reality is the ultimate monitor of quality of the data is the patient, right? And I think we need to do a better job of getting patients access to data so we can increase the quality. I'm a storyteller. I always tell stories. And last week I went for a blood pressure management thing. Next thing I know, my record says I have an HPV vaccine that went into me on Tuesday of last week. And I assure you that did not happen. So, if I wasn't a constant monitor of things like my financial records, my health records, I wouldn't catch that. And quite frankly, it's a little hard to fix it. You have to go through phone calls, talk to the right person, knows again to think. So data quality is really important. We make mistakes all the time, and it's important to me more that we have the ability to fix them and find them before they become worse. It's unlikely an HPV vaccine is going to do anything to my future healthcare or how they treat me, but maybe not. I don't know what's going to do 20 years from now in terms of what they won't do care for, because some computer says with HPV vaccine you can't do X, Y, or Z treatment anymore, and now I'm stuck on the wrong treatment path. That's unfair to me and the providers that are trying to provide care.
Yeah, without question. I mean, that's kind of wild to hear. As you look to the trusted exchange framework and the common agreement, how do you see Commonwealth aligning?
Yeah, well, first of all, we're 100% aligned, right? The thing was practically designed about the way we do business. The only caution I give is there are some significant gaps in the materials that have come out so far, particularly around how patients will engage and get access to their data. A little bit about kind of how much it's going to cost. We're frugal. We're a very tight budget organization, and adding in a couple $100,000 is actually budget-wise an issue. So we're pressing right now on our federal friends to make sure we understand the price, what we're paying for, and move forward. But we still expect to be QHIN number one, or at least QHIN wave one when we get to the second quarter of this year.
And Paul, finally, complete this phrase for me. Because of interoperability, by 2030, this.
By 2030, I hope that this isn't that far off. Healthcare works at subnuclear speed. How quickly a carbon atom changes into a different carbon atom. So my wager is one will see easier access between providers for discrete data. And it sounds like 8 years, like that. It could take that long. I am hopeful that we have a better patient identification schema, preferably with a national identifier, but at least by then I expect to have a conversation actually moving towards that. And I do expect that patients will have more access to their data. I'm not that hopeful that patients will know what to do with it yet. And I think, you always have to have a sequence. So first, at least get the access, understand what your data looks like, hug it, do what you want. And now, how can you help providers manage your healthcare better? Because it's yours. You're the most interested in your health than anybody else's.
He's the Executive Director of Commonwealth. That is Paul Wilder. And for more information on how your organization can join Commonwealth, we invite you to log on to CommonWellAlliance.org.